And welcome to the program, Sugar Talk with Dr. KG Lucas here on the Talk Station. Good morning, Doctor.
Good morning.
What are we talking about today?
Heart disease.
About heart disease. Does that have a lot to do with diabetes?
Yeah, sweethearts.
Sweethearts. Sweethearts. That's a good way to put it. Makes it palatable on a Monday morning. All right, so what is that relationship though?
Well, actually, diabetes is a major risk factor for heart disease.
Mm-hmm.
So it's up there with smoking and high blood pressure and high cholesterol as being a major risk factor. Because diabetes, puts more sugar in your blood.
Mm-hmm.
The sugar sticks to the blood vessels, the walls of the blood vessels. It can cause plaque buildup. So plaque is fat and all kinds of junk and scar
Mm-hmm.
tissue that builds up in the arteries. And what causes a heart attack, which means that you block off blood flow to muscle in the heart,
Mm-hmm.
such that the muscle can die. So the plaque builds up, but it doesn't just build up and build up and build up, it ruptures. So that means that the plaque is there and it may look fine, you look at it, well, it's only a little bit, but then it gets inflamed and ruptures and blocks the artery to the heart muscle, and then the heart muscle dies. So it's bad for ruptured plaques. So diabetes accelerates that process.
So you're talking about plaque getting inflamed. Does plaque have blood flow going in it? Is that what gets inflamed, or?
No, it's a blob.
Okay, it's a blob.
It's a blob.
Okay, all right. I was going to say how it gets inflamed.
But the body doesn't like certain blobs, and they inflame, and they get
Around it
inflamed.
gets
And
inflamed.
diabetes is a sort of an inflammatory condition anyway. The body's not used to this sugar everywhere, so the little cells that fight off infections start attacking the abnormal parts of the arteries. So they don't really know what sets it off, but they do know that statin drugs, which are the cholesterol drugs, actually prevent inflammation, and that's why they protect the heart against heart attacks, not just from lowering the cholesterol. So that's why some people, even if they have a normal cholesterol, might be put on a statin drug when they have diabetes, because diabetes is a major risk factor, and the statins keep the plaques from rupturing. So it protects the heart no matter what your cholesterol is. It protects the heart from the plaques rupturing.
Okay, so diabetics may be on cholesterol, anti-cholesterol medicine, just to lower their cholesterol,
Right.
but not to lower it, but just to prevent it.
Right, and people don't understand that.
Okay.
I don't think it's explained very well that it protects your heart. Just like taking a baby aspirin a day might prevent platelets, which are little parts of the blood that clot your blood, from accumulating on the plaque. So the aspirin sort of helps the platelets be a little smoother and not as sticky, and they don't stick to the plaque. Because platelets, the plaque has a bunch of stuff in it. It has fat in it, it has fibrous tissue. The platelets stick to it and clog it up even more. So the baby aspirin helps that, and the statins keep it from rupturing.
Do diabetics often take high blood pressure medicine too?
Yes, diabetes is associated with a lot of other risk factors, and that's where we get into this metabolic syndrome, which is even before diabetes. So diabetes is later, but what you have first is insulin resistance, and we've talked about that before. But the insulin resistance is associated with a lot of heart disease risk factors. It's not associated with smoking, it's the only one, but it is associated with high blood pressure, high triglycerides, which means you have a low good cholesterol, inverse relationship, and then it leads to increased fat in the abdomen,
Right.
and that can wear out your pancreas because you're having to make a lot of insulin to keep your sugar normal, and then you get pre-diabetes or diabetes later. But just having a metabolic syndrome puts you at risk of heart disease, not just having diabetes. A lot of people get diagnosed with diabetes when they present with a heart attack, and people go, well, a heart attack causes diabetes. No, well, it's sort of a gradual process.
Yes.
Both of them are gradual over time.
It's not a chicken or the egg
Right.
sort of thing. They're both they cohabitate.
Yeah.
Right? So what about blood thinners, diuretics? Are those associated with diabetes or help diabetics?
Well, the blood thinner that is used mostly is like a baby aspirin, like a small
okay,
dose of aspirin.
I gotcha.
Blood thinners are used to prevent clots, and these are not really necessarily clots. They're a little bit different. They have clotting tendencies, but it's mostly plaque. So it's just like on your teeth when you go to the dentist and they scrape the plaque off.
Right. The plaque is
Sort of-
like a beaver dam. It's just building up there.
It's just
not-
building up gradually over
Yeah.
time, but what's bad about the plaque, on your teeth, it just builds up and builds up and builds up. It doesn't rupture and take away a tooth, but that in the artery, it builds up and then it gets inflamed and then it goes crazy.
Okay. All right, now, what about strokes? Is that associated with this?
Yeah, all blood vessels can have plaque in it.
Mm-hmm.
So not only heart attacks, but strokes. Strokes are plaque buildup in the arteries to the brain, which is not good to lose part of your brain because it doesn't recover, just like your heart doesn't necessarily recover after you've killed part of it.
Mm-hmm.
The liver might recover. That's about the only organ that really regenerates. So your heart and your brain don't regenerate. The other plaques that are important are the ones to the blood vessels in your legs. Arms are not as important. The legs have these long blood vessels, and you're using muscles in your legs every day.
Mm-hmm.
And if you don't get enough blood flow to the muscles in your legs, they hurt when you walk. So people that have cramps when they walk, they stop and the cramps go away.
Mm-hmm.
That's because you're not getting enough blood flow to your legs. So it's an indication you have plaques in the arteries in your legs. Plaques in your blood vessels to your brain can appear by having what's called a TIA, or transient ischemic attack, or a pre-stroke type thing, where you feel numb on one side of the body, or can't speak, or have some abnormal neurological problems. And that's a warning that you may be going to have a stroke. And that can be also not only plaque buildup, but it can be a plaque in the artery in your neck that gets really, like, part of it breaks off. So you can have downstream plaques, and they can clog up little arteries too.
Is phlebitis related there?
Phlebitis is inflammation in the veins, so it's not really related. It's a whole different thing.
Okay, all right. But it's not a blood clot that travels around in, or...
Phlebitis is inflammation in your vein, but if you have thrombosis in your vein, it is a blood clot, and it can go to your lungs. So that's on the other side, but it goes up through your legs, up into your lungs, through your right side of your heart.
So there's a lot of things with blood flow. Anyway, it's just blood flow, period.
You want to keep the blood flowing, but not too much.
As good as you can. Now, how about the diabetes Are there diabetes medications that work on this as well?
Yeah, all diabetes medicines now have to prove that they don't cause heart disease. I mean, diabetes causes heart disease, so diabetes medicines have always been blamed. The lawyers like to blame them, for causing heart attacks or strokes. But really, the ones that have come through this with this long-term, it's called a cardiovascular outcome study, but they count up the number of heart attacks and strokes in the groups on the medicine versus not on the medicine. And Victoza has come through with preventing heart attacks. Now they put in their ads. And Jardiance.
Okay.
Those are the two diabetes medicines. The other ones have just been neutral. That means there was no advantage. These are the two that have come out that they actually gave an advantage to the people on them.
Okay. All right. Well, we'll have more to come in a moment. If you have questions you'd like to ask Dr. Lucas, you can reach us right now at these numbers. Coastal Daybreak here on the Talk Station FM 107 and AM 1240. Thanks for joining us. And Dr. KG Lucas is with us from Lucas Research. You can find them online at lucasresearch.org. And as always, you can give them a call too at 222-5700 to find out about your possibilities for being involved in a study. And speaking of studies, Doctor, what are studies involved in heart disease?
We have two cardiovascular outcome studies with diabetes medicine. One is a once-a-week shots sort of like Trulicity, and another one is a medicine sort of like Jardiance, which pulls sugar out of your body, and they're having to do long-term studies with those two. Then
Cholesterol study?
We have a cholesterol study for people with diabetes, and we have a cholesterol study for people that can't take statins. And that's another type of medicine for cholesterol. So those two are for cholesterol. We have gastroparesis, we have fatty liver, and we have a male hormone study with androgel, which is another cardiovascular outcome study. So they want people that have heart disease or have at risk for heart disease, and put them on androgel.
Okay. Now you mentioned about cardiovascular disease there, and there's a variety of them, or the people that can't take statins. Why would they not be able to take a statin?
Because it makes their muscles hurt.
Oh, okay.
That's a usual problem, and they don't know why that is. It's sort of weird, but some statin drugs, some people are very sensitive to that. That's the most common side effect, or muscle cramps from statins.
Are you doing still doing the fatty liver studies and
Yes.
oral diabetes studies? Or?
Yes, we have an oral insulin study.
And gastroparesis studies. All right, if you want to find out more about those, you go online too at lucasresearch.org. It's one of the best places to go to find out all that Lucas Research is doing, and you can give them a call and make an appointment as well at 222-5700. But if you go online, you also find there is a form there too that helps you kind of give them a heads up on the things that you already have diagnosed, and then you can find out whether or not a study fits for you. But you can come in and get that look over as well too, right? So check that out. Go to lucasresearch.org or give them a call at 222-5700. We'll see you next time.
Okay.